Thank you so much for joining me this morning. We are about to hear from Christian Dubé at 1 p.m. today. He's expected to announce probably how to move up the second dose of the vaccine that Quebecers are currently getting. And the vaccinations are going well. We're about to reach the 75% of adults vaccinated, I think Thursday, if I'm not mistaken. So
Partially vaccinated. Yeah.
partially, yes,
Yeah.
very important to mention, true, partially vaccinated. And I'm thinking, how is that impacting hospitals? Because we've seen throughout the pandemic, hospitals have been hard hit.
Mhm.
Uh, how is the partial vaccination helping hospitals right now?
So very clearly, it's a very large part of why Quebec hospitals are certainly under less pressure now than they have been even a few weeks ago. Excuse me. If you look at the numbers, even over the last week, the number of people requiring a hospital bed for COVID-19 has decreased by something like 54, 55 beds, which over that span of only a week is something like 15% or so reduction, which is fantastic. There's lots of data to show that vaccination, both partial and full vaccination, really do have a major impact at the end of April. For example, the United States put out their data showing that for people who have been fully vaccinated, that is to say, at least 2 weeks after their second dose for any vaccine that requires two doses, that that population has an overall risk reduction of 94% for hospitalization compared to an unvaccinated population. How about partial vaccination, which is actually very relevant to our current situation? That's still a quite a large reduction, but nowhere near as close. It's about 64% reduction for people who have had one dose. So I'm sure that's the major reason, I guess, to explain why we have fewer and fewer people requiring hospital beds in Quebec. Let's throw in two other factors. One is I suspect that areas of Quebec that were particularly hard hit, particularly in the first and second waves, also had a reasonable amount of pre-existing immunity from recovered disease. We saw the recent seroprevalence data reported that showed that really that second wave in the areas that were hardest hit, particularly Montreal and Laval, that there's a large proportion of the population that had detectable antibodies, and that was really before there was much effect, if any, of vaccination. So I think you have to sort of add that on. And then the last part of the puzzle is that at the present time in Quebec, if you look at the different variants that are circulating, in a sense, our dominant variant by far is what we used to call the UK variant or B117. Now we're calling the Alpha variant. And that one, although it is more transmissible, generally responds very well to the immunity produced by natural infection or by any of the vaccines. By contradistinction, some of the other variants, like the so-called South African variant, that one tends to not respond so well to the immunity produced by, to a certain extent, there's a reduction from natural immunity in terms of how effective it is against protecting against that infection, but particularly, for example, the AstraZeneca vaccine, that one doesn't generate much immunity against it. So in a sense, we, I know it sounds strange to say this, but you could almost say that we were lucky that our dominant variant has been one that is still easy to control with immunity, either from prior infection, which we have lots of, as well as from vaccination, which is very well underway. So we're that I think explains why things are going so well at the present time.
And how is it going to help if the second dose is moved up earlier for the people who already got their first dose?
So that's a good question. We're still at the point where we have certain groups in our population who are still needing that first dose, right? Only recently we've seen approval given, for example, for Pfizer for children ages 12 to 15. And so that group is actually getting vaccinated almost as we speak, at least in their first dose throughout this month. But that second dose is certainly very important, especially for people who are either at high risk of exposure to disease or high risk of complications if they get the disease. So already in Quebec, I would say we're doing very well for our elderly population that are in CHSLDs. You look at the numbers there, and that group we've done very well at vaccinating and now at giving them their second dose as well. And by some measures, we're hitting vaccination rates at around 90% or above, which if you look at the modeling data released by the ENSPQ, that really positions us very, very well, because once you have that second dose and you're at least 2 or 3 weeks out, you should have both long-lasting immunity as well as what I'd call a broad immunity against most of the current variants that we know about. So the trick is, if you look at the overall numbers, right? Yes, for that first dose in Quebec, we're at, for everybody who's eligible, 75% or so of the population have had their first dose. The second dose, we're much lower. I think it's 6%, something like that. And that, to my mind, is one of the big challenges in front of us, is to get that second dose into especially the higher risk populations as soon as we can, before we see what's happening. And there's already hints of this happening in some parts of Canada. I'm thinking particularly of Peel region, where they're starting to see an increase in the so-called Indian variant. I think they're calling that the Delta variant, where that seems to be even more transmissible than the Alpha UK variant. And it does seem to be somewhat more able to overcome the immunity induced by at least partial vaccination. So if we can get more and more of our highest risk population to get that second dose, that positions us better to not be vulnerable to if that variant were to suddenly arise within the Quebec population.
And what would you say to people, who got their first dose and who, maybe thinking about not getting the second one? Why we're hearing, the importance of getting your second dose is just as important as getting your first one. Why is that, and why would you encourage people to absolutely get their second dose?
For a few reasons. So very clearly, and this is a pretty fundamental concept in vaccinology in general, is you get a second dose, and that certainly seems generally to provide much longer lasting immunity. But as I said, there's a lot of data to show that in fact, the quality of the immunity induced by the first dose or the first exposure compared to the second dose is fundamentally different. For example, that second dose seems to give you much higher titers, much higher amounts of the neutralizing antibodies that really prevent the virus from binding to a cell and infecting the cell in the first place. There's also probably quantitative differences in that other part of the immune system, the cell-mediated immune system. And very clearly, people who have been fully vaccinated are much more resistant to vaccination from many of the variants compared to if they've only had that one dose. So I can't emphasize enough, partial vaccination is not the same. Don't rely on partial vaccination either for your own protection or for the protection of those around you. You've started it, you've gotten the first dose done, finish it off properly. And this is really what we're counting on, not only for the individual benefits, but for the collective benefits. You look at that modeling data, it's abundantly clear. We get our population doubly vaccinated at very high levels, and that's going to make it very, very difficult to have any sustained transmission in the Quebec population. That's going to make our schools safer and more stable, our workplaces more stable. Will protect our ability to go out and do all the things that we love about living in this province.
Yeah, and as summer is coming, and we're planning back to school, hopefully, so it's important people get their second doses as well. How is because we're currently in the deconfinement plan, slowly reopening things here and there. How do you think that's going to go, given last summer we were reopening things but we had no vaccine? This time we're reopening things, people are partially vaccinated. So how do you see the next few months?
So at the present time, with a few things with the ongoing availability of vaccine, which seems to be overall quite good. You know, there's still some delays, particularly with Moderna, but overall, there seems to be large amounts of vaccine that are not sort of acting as a rate limiting step to the efforts. At the same time, we're still vaccinating. What is it? In the last few days, it's been something like 70,000 doses per day. That's actually not a bad pace for us to be able to sustain. And I'm really hoping that we see that continue throughout the summer months, because that's really what's going to position us very, very well. So as long as we don't have the sort of worst case scenario of arrival of a particularly transmissible variant that also tends to overcome partial immunity into our largely partially but not fully immune population, as long as we avoid that sort of worst case scenario, then I think we're positioned well to have a good summer. I can't emphasize enough though, that while the vast majority of the population here in Quebec is not fully vaccinated, we can't act as if we are fully vaccinated. We still have to practice physical distancing, wear masks when you're in public places, avoid crowded places, particularly indoors for long periods of time. Outdoors is much, much, much safer, whether you're talking about speaking with your friends and neighbors, having a get together. Outdoors, you can physically distance much more easily, and there's much better natural ventilation there. Enjoy the beautiful weather, soak up some extra vitamin D. You know, I'm hoping this is going to be a summer of a lot of outdoor activities. And I think as long as people don't forego their second dose of vaccination for an extra day at the beach, then I think we're really going to be doing well for ourselves. And we are close to really finishing, well, maybe not finishing this off within the province, but we're close to really getting to a point where we're not going to have the same kind of instability that we've seen now for months and months, unpredictability. We have to shut school classes down here. We have to keep gyms closed for months at a time. We're very close to not having to do that now, but we've got to finish this off properly. You know, I don't want us to wind up sort of emulating the situation of the Leafs in the first round, where they were so close to finishing us off, but they couldn't quite seal the deal, and look what happened. And I don't want the same thing to happen to us here in Quebec.
Thank you so much for meeting with me this morning. I really appreciate the analogy there. Thank you.